There's concern about EMTs being ordered to bypass other urgent care centers. I think we ought to know that.
A demand for greater accountability.
It's hard to see how transporting somebody that far makes sense.
Paramedics pressured to bypass nearby trauma centers and instead bring patients to Denver health facilities, costing patients valuable time, possibly their lives.
A beautiful little girl in our city died. We want to make sure, did she get the right service? Did she get the best service? We owe that to her.
Denver 7 Investigates began digging into the claims against Denver Health last summer.
Since then, multiple paramedics have come forward to give us their account of the culture inside the paramedics department.
And tonight, city leaders are stepping forward. Here is Denver 7 Chief Investigative Reporter Tony KOVALESKI.
She didn't deserve to die.
For 7 months, we heard voices.
The culture needs to change. It needs to be investigated.
Veteran paramedics risking their careers, stepping forward and demanding accountability.
Why did they travel so far? Why?
And we heard the voice of the mother of an 11-year-old Sheridan girl wanting to know why questionable decisions were made in the hours before her daughter died.
Are you scratching your head and saying, how come we didn't know about this 5 years ago?
I think that is concerning that we didn't know about it.
DEVIN GRANBERY is Sheridan's city manager.
I think specifically, and I think what was most concerning possibly to the mayor and city council here was, why did they go to Denver Health when Swedish is straight down the street?
Right now she is not conscious, but she is breathing.
He's talking about the decision made 5 years ago. 11-year-old Andrea Plunkett was seriously injured by an SUV when she was riding her bike.
You're going Swedish? Denver Health.
Denver Health paramedics, for some unknown reason, elected to bypass a qualified level 1 trauma center at Swedish Medical just 2 miles down the street. Instead, they drove more than 6 miles, ran into traffic, and took more than 17 minutes to get Andrea to Denver Health.
This one is the last picture of us together that I'll ever get to have.
No one will ever definitively know the impact of that decision, but we do know credible national studies have found in a life and death trauma, every minute matters.
We will be looking into this in conjunction with Mayor Hancock's office and making sure that the issues get addressed.
There's concern about EMTs being ordered to bypass other urgent care centers or slow response. I think we ought to know that, and we ought to work to improve it as quickly as possible.
Denver's mayor has asked his manager of safety's office to investigate and review concerns raised in our reports.
I'm going to really look at how are we adequately putting oversight on that process to make sure things like this do not happen.
Let's take a look at it, and then let's get better. Let's improve services for the people of Denver.
Conversely, Denver Health has said since the beginning of our reports that it has done nothing wrong, and the hospital has not announced any changes to the culture inside its paramedics division. CEO Robin Wittenstein has declined requests to answer our questions. Late last week, she did announce her decision to retire later this year. I'm Chief Investigative Reporter Tony KOVALESKI.